أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسول الكريم وعلى آله وصحبه أجمعين. Assalamu alaikum wa rahmatullahi wa barakatuh. Brothers and sisters who are watching another webinar of the Psych Corner series, I have today, as announced, Dr. Ridhwan Saleem, a religious scholar as well as a psychiatrist. Inshallah, we'll be discussing the planned, announced, publicized topic, antipsychotic drugs, do they help? Inshallah. So it's open, organic discussion, inshallah. If you do have any questions, comments, please feel free to leave a question or comment on the comment section, inshallah, on the page. So let's start with the line, inshallah. Assalamu alaikum, Dr. Ridhwan. How are you?
Alaikum salam wa rahmatullah. I'm very good. Jazakumullah khair.
Barakallah. Thank you for giving your time for this webinar podcast, inshallah. Just before we go into the topic, you are a psychiatrist working in London, busy, especially during this COVID-19 pandemic. How did you, become a psychiatrist? Meaning, what made you become a psychiatrist? Was there any special kind of reasons? Maybe perhaps the audience wants to know.
Yeah, to be honest, I went in to study medicine at university. And I was just one of those typical Asian things, the day I was born, my parents said to me, "You're becoming a doctor." So that was my reason really for going into medicine. And during my medical college, I got a strong desire to study Islam, and I started learning Arabic, and I started attending some circles with Sheikh Hamza Yusuf and other scholars that were around in those late 90s. And from there, I got a desire to go and study knowledge. So I wanted to, after I graduated from medicine, I wanted to do something which would allow me to continue my Islamic studies. And to be honest, most fields of medicine are very demanding on your time, So psychiatry was one of those that seemed more promising in terms of flexibility for time. So that was one of the main reasons for going into psychiatry at that time, was to allow me to also study, carry on my studies in Arabic and Islamic studies, alhamdulillah.
Alhamdulillah. So you studied Arabic, you studied Islamic studies. You mentioned you started to attend some of the lectures of Sheikh Hamza Yusuf and others in the late 90s. I think most people, English-speaking kind of scene in the UK, in the West, probably the first time we saw people like that, talking in our language, lectures in our kind of language. Did you kind of study in a seminary or, like long-term, or what was your background in terms of Islamic studies?
So after studying, with Sheikh Hamza, we went off. I studied for 1 year after that in Liverpool. It's unusual. Sounds like an unusual place to go and study, but there was a sheikh.
I remember.
there was a very good, knowledgeable sheikh up there, Sheikh Siraj, who was originally from Bangladesh, Darul Uloom teacher, but he was in Liverpool. So we studied with him for 1 year, and then after that I went to Syria and studied in Damascus for about 4 years. So alhamdulillah, that was mainly in Damascus. We studied mainly privately with different ulama, rather than going into one of the seminaries there. And alhamdulillah, Allah made it open up the way to be able to do that. So alhamdulillah.
Yeah, I mean, when it comes to knowledge, or any kind of knowledge, any kind of beneficial knowledge, and I guess medicine, psychiatry, anything that benefits mankind is beneficial, right? Anything that benefits mankind is Islamic knowledge. From the Islamic perspective, we don't really demarcate those kind of fields, if you like. Obviously, there are sacred knowledge, is very, very clear cut. But anything that is beneficial, as Imam Shafi and others have mentioned, if we have the right intention, inshallah, people will get the reward for it. So alhamdulillah, you've kind of you've done the traditional side, as well as the, if you want to call it, the secular aspect, and you're treating, people who you are benefiting mankind, not just Muslims, but obviously the whole of mankind, people from different backgrounds. And the Prophet Muhammad said that the best among you are those who are most beneficial to the people. So it's a good place to be in. Alhamdulillah, so may Allah subhanahu wa ta'ala reward you for that. So in terms of the topic is huge. From the historical perspective, in the UK at least, perhaps, or in Europe, mental health or mental illness, people who suffered from mental illness, they were frowned upon in society generally. They were left in hospitals where they were being electrocuted. People they were called demons. All sorts of things were being done to them. After the kind of, if you like, post-industrial revolution, when things began to change, government funding came in, hospitals began to emerge, and specialist hospitals began to emerge to treat mental health or mental ill patients, and new drugs came into the scene, new kind of treatment came into the scene. So maybe if you want to quickly give a brief background on that, in terms of, from your understanding, from your background, how where we were perhaps in the UK at least, and where we are at the moment, if that makes sense.
Yeah, oh wow, subhanallah, that's a huge thing you've opened up. But I suppose I can mention a few things that come to mind. In terms of the historical context, as you mentioned, is very important. I mean, one of the amazing things is how advanced Muslim psychiatry was many centuries, before the West really understood mental health. As you say, in the West, before about 150 years ago, in Europe, madness was very much seen as a type of demonic possession, and the main treatment would be considered to be exorcism and things like that, because the Bible talks about Jesus casting out the demons, things like that. Interestingly, many people don't know, but Muslims never had that sort of type of exorcism in, this is my argument anyway, in our sources, and there's an interesting book, I think one of the best books I've come across, which treats mental health and mental illness in the Islamic world, in the medieval period, is a book called Majnoon, Madness in the Medieval Islamic World, by a professor from Oxford, whose name is eluding me right now. Yeah, I can't remember his name. Dolls, Dolls. Is a very expansive work. Looked in a lot of detail into psychiatry and mental illness amongst Muslim in the Middle Ages, and one of the things is very clear, that Muslim doctors and physicians, they treated mental illness predominantly as an illness, not as a possession. And the possession, I mean, that did come in amongst the Muslims as well, but it was a minority, not amongst the study of medicine, because the Muslims mainly took on the Greek medicine, and the classical Greek medicine. Galen was one of the main people that the Muslims relied upon. It always saw mental illness as a physical illness, an illness of the brain, an imbalance within the body. So yeah, the interesting thing with the Muslims, in the Middle Ages, as it's called, was that Muslims had hospitals, they had mental health wards, and they even had things like, different types of therapy, psychological therapy. Some Muslims even talked about musical therapy, things that are very modern, you could say. So that's the sort of come about in the last 150 years. Is a the first psychiatric institutions in Europe, they used to be called lunatic asylums, you know, sort of late 19th, turning over into the 20th century. So there were large buildings, and they often had nice, you know, outside areas, grounds, and they would put the sort of mad people in those. And as you say, then there was a lot of experimental treatments going on. This is, you know, bringing back to the topic we're on today. Um, and most of the psychiatric medications we use today were discovered, you know, during that period of experimentation, really. They were just found by trial and error, rather than any sort of solid scientific basis behind them. And so that was, you know, around about the 1930s, 1940s, the first sort of modern psychiatric drugs started being discovered in those asylums.
Yeah. In terms of the kind of, the discussion we're having, Jazakallah khair for that. There is there is a lot of literature, research carried out by various different experts, even psychiatrists, psychologists, counselors, and academics regarding the harmful side effects of antipsychotic drugs, right? And there's heaps of literature. There's a whole movement in the UK, in America, and other parts of the world. And recently, I came across a video regarding it was called, I think, medicating normal. And it says that basically we are over medicating the population in the UK. People are every year. There's an increased number of people who are on antidepressants. I mean, do you see there is a problem in that, in terms generally about, even, there was a report I read somewhere a while ago about, 11-year-olds in schools taking antidepressants, over 10,000 children. I mean, I wonder whether you see, if, whether this is a problem that we need to deal with. How do we deal with it? Or do children at that age need antidepressants?
Yeah, I mean, Jazakallah khair. I mean, generally, first of all, there is an over-medicalization of all aspects of human life, generally, not just the mental health issues, This is true, and it's a result of a sort of scientific culture, a society that we live in. The globalized culture is a sort of a scientific one. So it's a secular, non-religious, scientific sort of culture. But specifically with the medicalization aspect, there's obviously a lot written about the impact of capitalism upon the whole medical field. There's a lot of money to be made. No one can deny that. As you know, I'm sure, and most people know, pharmaceutical companies, companies that supply medical equipment, vaccine in the world, maybe second to armaments. So when you're talking about that huge sums of money, there's going to be distortions. And the people who mainly write about that are medical anthropologists. They research a lot into the aspects of Western biomedicine and so on. So I think I definitely wouldn't deny that there's an over-medicalization of many aspects of human life. Just a non-mental health example would be something like pregnancy. Pregnancy, a very natural process, Whereas in the past, people would have had a very natural, they would have given birth with midwives. It's not something, that needs to be medicalized, but in our society, it's become so over medicalized that at every stage, you're seeing doctors, there's examinations, all these things. And so that's well known that those sort of aspects can lead to a lot more problems than they solve. So with mental health, I think similarly, there's way too much, over medicalization of the mental health field generally, and a lot of overuse of medications.
In terms of, I was obviously we don't want to go into the discussions about there's a lot of discussions among experts online and other spaces regarding is that if a person is critical about psychiatric drugs, that as you say that society generally we're over medicating, and mental health also over medicating, and some people if they are critiquing that even from an academic perspective, others will label them as anti-psychiatry, right? And the other extreme is that, okay, medication is the only way, medication is the main way to treat and or prevent mental illnesses. And there's I can see there's two kind of, if I want to call it extreme, or two ends of the spectrums. And from a Muslim kind of perspective, or from an Islamic perspective, we know, for example, there's a whole discussion among the scholars regarding, okay, is taking medicine, is it wajib, or is it fard, or is it sunnah, or and whatnot. But parking that on the side, how should we as Muslims generally, right, when we read those articles, or there's so many videos on YouTube, from the Islamic perspective, how should we approach it? Should we take a side,
Yeah. Yeah, I mean, I think you're right. I think you're right. There is a middle way, which I think is, each extreme position is a bit too much. It's like, like they say, throwing the baby out with the bathwater. Yes, I agree there is over medicalization and over prescribing of these medications, but that's not to say that they're not useful in some patients that have more serious mental illness, let's say, So even if you look at, let's say, take depression, for example, there's different grades, within the classification. So you get mild depression, what they call mild depression. Obviously, the person suffering from that, that's not very nice to say to them it's mild, but they're feeling horrible, So it's not to negate that it's a terrible state to be in, but in terms of clinical symptoms, severity, we get mild, moderate, and severe depression. So on the severe end, the person is basically, they won't be able to sleep, they'll have difficulty getting sleep. They wake up very early. They can't eat. They lose a lot of weight. They can't find enjoyment in anything. They can never smile or laugh. They lose their motivation. They get a lot of negative thinking. So if they have all of those symptoms, then they get on the severe side of depression. And even traditionally, even before modern medicine came into place, that was a recognized medical condition. And the Muslims recognized it, severe depression. In English, it used to be called melancholia, and it becomes a physical illness, at that point. And the Muslim physicians in the past, they went into a lot of detail on mental illnesses. If you read, any of the, nowadays, a lot of this stuff, we haven't even looked at it, Like even the most famous medical text of the Middle Ages, Ibn Sina's, Qanun fi Tib, his massive encyclopedia on medicine. There's massive areas dealing with mental illness, severe depression, all these things. Unfortunately, even myself, even though it's my field, I haven't had the time to, go into what all the Muslim scholars have said. But some of the stuff I have read is really interesting. So we recognize there is a place for medication, I would say, especially when it gets very severe, you know, and medications can, I would say medications can alleviate some of the suffering and some of the symptoms. So in mental illness, rather than looking at medication as a cure, you know, sometimes people think, oh, illness, cure. With mental illness, is not really like that. Mental illness is something that has come about through a lot of trauma or a lot of, you know, a lot of time. So in my view, you know, medications can be very helpful in some patients to alleviate some of the symptoms of that extreme distress and suffering that they're going through. But I think the underlying causes are the things that you also have to look at. And even, you know, psychiatrists, even modern psychiatrists, they do recognize that, even though, you know, patients may often experience the doctor just gives a pill. But if you go into psychiatry, we always say, look at the biological, psychological, and social aspects of the treatment. So the biological, which is the medications, is just one part of the treatment. And often the psychological and social aspects are very important for the treatment. So I think one of the things that I would like to share with the brothers and sisters watching, which I found to be really helpful, and this is taken from our own, you know, our own traditional Islamic medicine, is that for melancholia, for severe depression, what our scholars and our doctors said was that the human being is composed of mind and body. You know, you have the mind and you have the physical body, and both of these need to be active. You know, that's how the human being is created. That's how Allah's created us. Our nature is that He's given us aql, mind, and He's given us a physical body, and they have to be active. Both of them have to be active to be healthy. So I found that to be a really, you know, spot on, amazing insight. Because when, even if you neglect either of them, if you don't keep your physical body active, you will get into physical illness and also mental illness. And the similar thing with your mind as well. If you leave your mind idle and you don't use your mind, you know, to study, to gain knowledge, to exert yourself in meaningful, you know, mental activities, if you leave the mind idle for long periods of time, you will get into mental illness. And I found this also in Western tradition, in traditional medicine. There's a book. I can't remember who it was by. It was by one of these medieval scholars from England, and he was talking about melancholia. And you know, it's surprising to know that in those days, the main people that used to get melancholia or severe depression were actually the richest people in England, the aristocrats. And the reason was because in those days, it was considered to be below them to actually work, to do physical work. So a lot of them led what was called lives of leisure.
Nothing much has changed.
So they used to lead lives of leisure, you know, these rich dukes or barons and people like that. And but they would then fall into this deep depression, this melancholia, because they're just letting their minds, you know, completely be idle, and even their physical bodies, they had nothing to do, no work to do. So I think for me, that's really, really crucial for many types of mental illness. If you can keep your physical and your mental faculties active and engaged, honestly, you will avoid a lot of mental illness. And even those that have fallen into the mental illness, they can use that as a way out, you know, to get better for long-term cure. They will find it difficult. They won't have the motivation because they're in that severe depression. But they have to sort of force themselves and make it like, you know, I have to do this physical activity every day. I need to do this mental activity every day. But if they force themselves, inshallah, that will lead to a lot of improvement in their symptoms.
When you were mentioning, there's I mean, Ibn Sina and Razi and others, they mentioned about keeping your mind fit to keep your body fit, keeping your body fit to keep your mind fit and healthy. When I was learning Arabic, one of the first kind of Arabic proverb that our teachers taught us was that al-aqlu salim fi jismi salim, or a sound mind is a sound a body, and a sound body is in a sound mind. So I mean, within even the Arabic language, within our tradition, these kind of anecdotes, if you like, or these teachings are embedded within our literature, within our even learning Arabic language, alhamdulillah. And obviously, this is from the Sunnah of the Prophet Muhammad sallallahu alaihi wasallam about keeping fit, keeping healthy, keeping the mind of tafakkur. Allah subhanahu wa ta'ala in the Quran, always talks about references, أَفَلَا يَتَدَبَّرُونَ يَتَفَكَّرُونَ, do they not ponder, do they not think, or do they have locks inside their hearts? So I want to just go back to, in terms of the drugs issue. In your experience, have you kind of seen, and maybe if you're not obliged to kind of mention it because of your profession, that's fine, seen patients who've kind of like have been on antipsychotic drugs for a long time, and they tried to come off, but they did come off. They had withdrawal symptoms, because there's a lot of people complaining now. A lot of people are writing about patients who have been taking antipsychotic drugs, and now they're trying to get off, but they're going through really severe withdrawal symptoms. And maybe you can kind of just briefly explain to the audience what withdrawal symptoms are, perhaps.
Yeah. I mean, when you say antipsychotic, are you meaning just antipsychotic, or do you mean antidepressants and all?
Perhaps also antidepressants. Yeah.
Yeah, because within the psychiatric drug range, antipsychotics are one, but we also have antidepressants. Yeah. We have mood stabilizers. Yeah. We have anxiety drugs, of which there's several different ones. So I don't know if you want me to comment generally on those, or
I think generally it'd be good. Generally it'd be good, inshallah.
Yeah. I think so. As I say, within psychiatry, the sort of range of medications is those what I just mentioned. You have antipsychotic, you have antidepressant, mood stabilizers, and then you have anxiety medications, anti-anxiety medications. And then you have a few others, but they're the main sort of categories. And it's interesting as well, because the Quran, often mentions وَلَا خَوْفٌ عَلَيْهِمْ وَلَا هُمْ يَحْزَنُونَ. There's no fear and there's no sadness. So these are the two ways that the human being can become mentally unwell: sadness or fear, or in other words, depression or anxiety. One is to do with the past and the other one is to do with the future. So the depressed person is generally depressed about the past, whereas the anxious person is anxious about the future. So it's really amazing that the Quran, it sums up basically the two ways that the human being can become mentally unbalanced. And both of those, ultimately, they're cured by our deen, aren't they? Because a person, if they keep their strong iman, like, we don't worry about the past, because the Prophet ﷺ said, don't even look back and say, if only I did this, if only I did that. Don't say low. That opens up the bab of shaitan. Just say qadar Allah wa ma sha'a fa'ala. We should just say whatever Allah willed happened. So the past for us is nothing to be sad about. And the future, of course, we have tawakkul. That's the concept of tawakkul, isn't it? Anyway, sorry for digressing. I mean, I think so. Those are the main sort of medications. Now, antidepressants definitely can cause withdrawal symptoms. So antidepressants, if you've been on them for a long time, you shouldn't come off them suddenly. If you want to come off them, what you do is gradually reduce the dose over several weeks or even a couple of months. And then you can come off and then you'll be fine. You won't get withdrawal symptoms. It's only when you come off suddenly. But if you have a, if you have a doctor or a psychiatrist guiding you, you can come off it gradually and you won't have any problems. With antipsychotics, you don't generally get withdrawal symptoms as such. What you can get is your illness coming back. Antipsychotics are given for a specific, type of mental disorder called psychosis. And if someone has psychosis, which can be sometimes through having a very, very severe depression, or it can sometimes be through having schizophrenia or related illness. Then if you are prescribed antipsychotic, it may control those symptoms, but then when you come off the antipsychotic, the symptoms can come back. So, but I wouldn't really call that withdrawal symptoms. That's just the illness coming back because you're no longer taking the medication.
Just to interject, you mentioned about there's been some studies or even some psychiatrists, discussing about a number of people taking, for instance, antipsychotic drugs for severe psychosis, for example. It kind of, as you mentioned, alleviates some of the suffering, but in some cases, apparently, people, it made it worse, right? The actual drugs made it worse. What's your view on that?
I think, with antipsychotics, they are very powerful drugs. And as I said, they were discovered by chance, experimenting on patients. So I think the first one was a drug called chlorpromazine. I think it was discovered around about the 1940s. And then a whole load of others were developed in sort of, in similar fashion. They are very, very sort of powerful, but they're very crude as well. And it's basically like trying to treat someone with a sledgehammer, And so someone who's psychotic, just for brothers or sisters that are not that familiar with the term, it's not because the lay people understand psychosis different to what we mean by psychotic. So psychosis is basically a person who has really, really severe mental illness. And their basically perception of reality completely breaks down. Sometimes in common layperson term, we call it a mental breakdown. But it's to the point where they no longer hold on to reality. So, for example, they may start believing a lot of really odd, bizarre things that are not true. They might become very, very paranoid and think that there's spies after them, or people trying to kill them, or people trying to poison them.
Hear voices, for example.
Yeah, sorry?
They hear voices.
They may start hearing voices that are not really there. And also in some cases, their thoughts can become confused and jumbled up, what we call formal thought disorder. So they basically, it's like the sort of typical madman. So when he speaks to you, you can't understand really what he's saying. He's talking gibberish. That's another symptom of psychosis. So they're basically the three main symptoms of psychosis.
What about hallucinations? Is that also?
Yeah, voices are hallucinations.
Voices,
You can also have visual hallucinations, but they're less common. The most common are voices. They can hear people talking, but they can't see anyone.
Yeah, I was referring to, seeing different things or seeing people.
You can, yeah. But it's much less common, but it does happen from time to time. That's more common in elderly people that get dementia, but it can happen in younger people who have psychosis as well. So with these, very extreme people, if you give them an antipsychotic medication, it's called a major tranquilizer, because your mind has become really overactive in that psychotic episode. It's like your mind is just going wild, So what the drug really does is tranquilize. It slows things down. So the patients, the thoughts become more settled. And the person often will stop hearing the voices. They may stop having those delusional beliefs. But there are side effects, and these drugs, they do cause people to become like zombies, you know, just to put it in a layperson's. So the person will be very stiff. They maybe have a stiff, you know, posture. Um, their facial expression may become a bit blank, but that could be part of the illness as well. And you know, they might be drooling, for example. You know, their muscles may
Yeah.
seize up. So they can have nasty side effects without doubt. But you have to then ask yourself the question, you know, should you leave the person psychotic and going through all of that distress that they're going through, or should you try them on an antipsychotic medication and hope that the side effects are not too severe? I mean, I'm asking, I don't know
I
what
guess
you think, but this is the
oh,
dilemma that
yeah.
psychiatrists face, you know?
I mean, if I guess maybe, and correct me if the analogy is wrong. I'm not a doctor like you, but you know, if someone was stabbed, as an example, right, and obviously that person going to the hospital would require pain relief, right?
Yeah.
Perhaps it's similar. A person who is suffering from severe psychosis, is hallucinating, hearing voices, seeing things, and you know, really erratic behavior, it's probably harming them and potentially may harm others. So, you know, to take a medication or medicine is to ease the suffering and, as you said, tranquilize the situation. I mean, it's a similar analogy, to be honest, isn't it? But I guess I wanted your view on that. That's, I think, no one would disagree. No one should disagree with that. You know, I haven't come across anyone disagreeing with that. But in terms of long-term treatment, you know,
Sorry, Sheikh, if you don't mind me cutting
of
you
course,
there.
of course.
The thing is, a lot of people, like you said, you know, a lot of people do disagree nowadays.
Okay.
You know, the whole anti-psychiatry movement is quite, you know, so they will basically say these drugs should never be used. You know, they do go to that extent.
On that point, you know, from the Islamic perspective, look, you know, there are different opinion classically among the scholars about should we take, you know, you know, medicine or not. Majority of the scholars, they say it's not wajib. A minority of the scholars, they say is wajib. I subscribe to the view that it is actually wajib. When, like you said, a person who is suffering from kind of severe psychosis is probably harming themselves, potential harm, you know, harm for others also. You know, that person, giving them talk therapy will not really benefit that much, right? So at that moment, that person needs to be managed, right? So in that moment, I would say again, perhaps get your views also. At that moment, is from an Islamic perspective, you can say it's wajib for that person to take that medication, right?
I think, you know, like you said, I mean, a lot of those guys, when they get into that state, they actually can be quite dangerous, either to themselves or others. In that case, you basically got two alternatives. Either you're going to lock them up and tie them up, even like they used to do in the old days, or you're going to give them this type of medications that were going to tranquilize them, but could have nasty side effects, fairly nasty. But obviously, if we do see very nasty side effects, we would try a different medication. You know, as psychiatrists, that would be the approach. But potentially, you know, I'm not going to hide the fact that potentially the side effects can be even life-threatening. Wow. But bear in mind that most medications have rare, serious side effects. Yeah. Even your paracetamol and your aspirin and, you know, all of your medications. I'm sure you know if you look at the potential side effects. So same is true of psychiatric drugs. But I think there is another category, the psychotic person who's not dangerous to himself or to others. Let's say he's just psychotic, he's a man. You know, sometimes you come across these guys wandering around, they're sort of talking to themselves, they don't make any sense, but they're not really harming anyone, and they're not a danger to themselves. I think there's a different question. You know, we should, I would say ethically even, if the person had a choice when he was well, and he could say, look, if I do become unwell like that, I want to take the medication or I don't want to, then I think we should follow their wishes. Because in that case, they're not harming anyone, they're not harming themselves. if they don't want the medication. But the problem is normally when they are psychotic, then we can't really ask them, do they want the med? We have to try to figure out if they were well, you know. So it's like me, for example, me now, if you ask me, if you ever became psychotic, would you want to have antipsychotic medication? I can make that decision now because I have the full capacity, you know, I have the knowledge. So that would be the ideal, you know, if people could make that decision. And then, like you say, it would depend a lot on if they're a danger to themselves or others as well. If they are, then you know, you have little options.
And ideally, obviously, medication should be avoided, but generally, medication should be avoided. I mean, in the sense that we are living in a society, or we are living in an age where we are over medicating generally. You know, back in the 80s or before that, sorry, Huxley wrote a book, The Brave New World. You know, and he talked about how, you know, machinery and technology will take over, and to become happy or to get excitement, we have to take medication, you know, soma, right? And we are actually in the heart of that age, what he was talking about. So generally, obviously, you know, medication, generally we should, even, you know, as a doctor, you know, and you know this, and my GP and others say, look, we should generally, you know, not take paracetamol even, right? Unless you really, really need it, because you can get hooked, and you can become immune to it. You have to take more and more and more, right? But in those specific, as you mentioned, in those specific situations, what do? You know, you can't. You have to protect that individual and protect others, right? Going back to when you're talking about psychosis, you know, why, you know, when we're talking about severe psychosis, people hallucinating and hearing voices, seeing things, and talking to themselves, and murmuring and whatnot, what are the main causes? Why do people are affected by those illnesses?
So I mean, you know, the main two causes are what we call schizophrenia and related disorders, and severe depression can also lead to a psychosis. So the causes of mental illness generally are multifactorial. So there's normally not one specific cause that you can identify. And you know, there's a lot of talk about genetic predisposition as well. I think, you know, the evidence is that there is a genetic, but what it means is basically some people are more vulnerable. If you're, say, from a certain genetic family where people have a lot of mental illness, it doesn't mean you will get the mental illness, but it means you're more vulnerable. So just for example, average person would have about 1% chance of getting schizophrenia in their life. But if you had a parent or both parents had schizophrenia, your chances would go up to 10 to up to 40%. So, but it's so there's a little bit of genetic, you know, your sort of genetic makeup. Some people are just more vulnerable than others. But normally then what's more important are the life events, you know, so the sort of life experiences that people go through. If people go through a lot of stressful life events, that can often lead to, you know, a depressive or a schizophrenic breakdown. Sometimes it could be just one stressful event, but it's very, very traumatic to the extreme. Like I've had some patients that came out of Guantanamo Bay, you know, and they were completely psychotic, but they were otherwise very healthy, but because they'd been through that extreme trauma, so that, you know, but for most people that we see, they sort of like it's over their lifetime. You know, they've had different things happen. Sometimes they may have had things happen when they were young, and then other things. So traumatic events really, you know, lead to these type of illnesses as well.
I mean, the genes, the environmental, the brain, you know, the connections interact with you know, billions and billions and permutations. It's very difficult to kind of say that this is the actual cause, right? Because there's
Yeah.
so many interfaces, there's so many connections and permutations. In terms of, I mean, you really nicely mentioned in the beginning about, living a balanced and healthy life. In Islam, as far as I understand, there's a lot of emphasis on prevention. They say prevention is better than cure. In Islam, there's a lot of emphasis in the Quran and the Sunnah, whether it be our psychological, our spiritual, our mental, our physical well-being. There's so much emphasis on kind of prevention, right? And what are the, I mean, I know this is a very somewhat vague question, but you touched upon it. Perhaps, for our viewers, mention it again in somewhat more detail, perhaps, as much as you can. What are the things that we could do, right? Apart from generally, exercising, for example, as you mentioned, being active, physically being active and mentally being active. What are the other things? Are there any other things that we could do to perhaps, prevent us being affected by trauma when there's a loss of a loved one, for example, or losing a job? These are traumatic experiences, right? How can we? I guess what I'm trying to say is that how can we build our resilience? Right?
I mean, I think this is where the Islamic psychology is so important, and there are some people now. I'm sure you've probably had your webinars with some of them who are developing that field to some extent. So a sort of psychological, spiritual therapy. So, I mean, the bottom line is, if we can build up our iman and build up our relationship with Allah subhanahu wa ta'ala, we will be more resilient to these type of traumas. That's I think people recognize that, like you mentioned, Imam Ghazali. At the moment, I'm teaching a group of students from Ihya Ulumuddin. And Imam al-Ghazali is also one of those that talks about, that if we have a strong iman and a strong relationship with Allah subhanahu wa ta'ala, when we're faced with tribulations, we'll be more resilient. So he talks about, the normal believer, the mu'min, he's like a plant. When the wind blows, the plant will bend, but it will always come back up again. So yes, we feel the trauma, we find it difficult, but we always come back up. We have sabr for the sake of Allah subhanahu wa ta'ala. And above that, we have shukr, even during the tribulation, because no matter what the tribulation, there's always a gratitude, because, it's like now, may Allah make it easy for everyone. People are going through a lot of, losing their jobs, a lot of tribulations, things like that. But then if we look at other Muslims in different parts of the world, compared to them, we're in a state of, we can't, so we always have to thank Allah. And then Imam Ghazali says, for those who are the people of really strong iman, they're like mountains. So no matter how hard the wind blows, they don't move. They don't even move. They're just solid, So the stronger our iman, the stronger our relationship with Allah, that's what we should work on if we really want to avoid getting into mental illness and mental disorder. Then there's other practical things, like I think you hinted to as well. Diet is very important, having a balanced diet.
Absolutely.
We know the sunnah, just to eat less is key, but what we eat as well. So our Muslim physicians, they recognized things like mental illness to be about imbalance of the internal body humors, and that's all to do with the food and the drink and everything. So that's also very important. But I think personally the key is that what I mentioned before, to keep active. A lot of people after they retire, they fall into depression because now suddenly they're not doing anything with their bodies, they're not doing anything with their minds. So keep your knowledge. Even when you retire, I've seen a lot of Muslims start using that time to start learning Arabic so they can understand the Quran. So it's never too late, always keep up your pursuit of knowledge, your study of the Quran, Arabic, all these things. You should never stop,
inshallah. Jazakallah khair, Dr. Ridhwan. Really beneficial discussion. Obviously, this topic is very expansive, and we can't really cover everything. But
Yeah,
hopefully, the discussion that we've had tonight has been beneficial for the viewers, inshallah. I think the takeaway for me is we're talking about mental illness and medication, is that look, as Muslims, whatever we are doing, we should approach it in the moderate balanced way, neither on the right to extreme, on the left or the other extreme. Everything it should be done in moderation, and in particular, looking at approaching things holistically and consulting the relevant experts in a particular area. So Jazakallah khair for joining us today, inshallah, and hopefully we will be back again with another podcast or webinar on a related topic, inshallah, on mental health. Until next time, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.